They call him the human Ken doll. At age 32, he's already had 90 cosmetic procedures. His upper body is covered in rock-hard prosthetic muscle implants. Those triceps, not real. Neither are those pecs. A total transformation head to toe, and it is not over. In fact, he's flying to Miami for potentially more just hours after this show. So why does he do it? How far will he go? He is taking your calls right here with me, so start dialing. Sorry, we'll be taking your calls in just a second. Justin is going to be here with me. But first, I want to read you a Twitter. I told you I was bored with that last topic, but I'm going to read you an interesting Twitter. It says, at Dr. Drew, you're repeating rumors, salary, living arrangements, etc. Your guests are repeating as fact unless you verified irresponsible. As I said, we have not verified that. We were talking about the possibility that the living arrangement, the situation of financial distress may have had some role in that poor nurse's demise. Now, we are going to change roles. Speaking of roles, we're going to change entirely the topic here to something else. This is Justin Jedlicka. You've had head-to-toe procedures. You're called the human Ken doll. Where did that come from?
Yeah, it was dubbed to me by 2020.
Were you offended by that? Did you like that?
No, I was flattered.
You were flattered by that?
Totally.
So you're going for the plastic man look?
I like looking a little overdone, definitely.
Overdone. So what have you had done, speaking of done?
So I've done 5 rhinoplasties, 5 nose jobs.
Why 5?
You know, the first one was a need, and everything after that, it's been a want, I think, surgically. So it was decent, but I wanted something a bit more refined, a little more chiseled. 5 rhinoplasties. What else? I had a brow lift. I had a coronal brow bone shave, where they shaved the bone ridge off here.
So they actually took your eyebrows, this bone here that men have, and just, I mean, that's no minor procedure. I mean, when you're cutting into bone, people don't understand that's a major deal. And by the way,
it's a decent surgery to have.
And that's painful too, right?
It's more uncomfortable than painful, totally. But there is an incision from ear to ear across the head, right, to be able to access that space.
And they have to, I mean, chew through bone. All right. So
yeah, they grind it off. Yes.
They grind off bone.
Yeah.
All right, so they really peel down your forehead,
correct,
grind off the bone, 5 rhinoplasties, lips.
Yes.
How many times?
4, because it's a building process with permanence.
Okay, keep going. What else you got?
4 sets of injections on the apples, 3 sets.
Apples?
The apples, the frontal portion of my cheek here.
Okay.
3 sessions on top of the stems of my bone here.
Sessions of what?
Injectable.
Of what?
I did permanent injectable, so I have silicone injections.
Silicone injections into the soft tissue?
Right.
Aren't you worried about them migrating or moving? Or?
If you get through your initial 2 weeks of healing and recovery with that, the fibrosis process happens around that, and they shouldn't migrate unless you end up in some sort of an accident, which would equally dislodge any sort of a hard implant.
Okay, so keep going.
Instead.
Chin?
Chin, 2 sessions of silicone.
Neck?
No neck.
No neck. Chin, you don't have an implant. You had.
I had injectables to pump out the cleft and then give a little more prominence from the profile.
All right, and then you've actually had your body done too.
Right. I've done pec implants with solid silicone implants.
Like a woman's breast implants?
No, there's no fluid to the interior of it, no gel.
It's like a firm implant, all right.
Correct.
And then what else?
A bicep implant, tricep implants. And I've done fat transfer on my face, and then, you know, temporary injectables I've done too. I've done my buttocks as well, 13 sessions of silicone injections.
Okay, here's the deal, my friend. I would like to examine what you've got going on here, if you'll permit me. just to kind of see what's going on, because I can't really, like, imagine.
Are you hitting on me, Drew?
I'm not hitting on you. I'm not hitting on you, but now that you mention it, no. I'm not. I just can't imagine where, I want to talk to your doctor, too, but I'm interested to see how this all fits together. Would you permit me?
Are you sure?
Yeah, I want to see. Here's the deal. Okay, if he'll permit me, when I come back, we are going to take a look at Justin's implants and surgeries. I mean, you can see with the face. I mean, we sort of pointed all that out. But this is going to extreme measures, seems to me. And I also want to talk to his surgeons. We'll get to all that. That's up more. And your calls, 855-DR-5. I'll be right back. I am back with Justin Jedlicka, who is flattered to be called a human Ken doll. I want to get into this a little more, my friend. Should I call you Ken or Justin?
You can call me Justin.
I'm sure Ken is going to come out of my mouth. Let's have a little, if you don't mind, sort of a little doctor's visit here.
All right.
Let's take the coat off. Okay, let me help you here.
Okay.
Now, your mic is coming off with this, so I'm going to have to actually hold the mic up.
Okay.
You're all hooked in. And the shirt, you don't have to take your shirt all the way off if you don't want to, but
all right. I don't know how we're going to get around.
All right, so go ahead.
All right, so let's go.
You're obviously very timid about this.
Shy.
Yes, I see.
You live in LA. You've never seen these before.
I've seen people with their shirts off. So here we go. So this is all silicone here.
The silicone solid implants, correct.
And this
we have biceps.
All right, hang on a second.
Solids in here.
So this is not even in the muscle. It's on top of the muscle, isn't it?
It's under the fascia.
Right,
the
but
arms are subfascial, and these are actually under the inside the active muscle.
So this
but the
is
bis and tris are just
right. This is okay. This is slung into the muscle, right?
Right, correct.
Now these I must tell you, Ken, these things feel bizarre. The triceps,
no.
Yeah, they do. And they make me worry that they would migrate. I mean, how do they hold them in place?
There's a pocket that's cut, so there hasn't been any movement. There won't be any movement since we've been healed.
Let me show this part. Where's the camera? Is it this camera? Yeah, this is this sort of sits on top here. And
but they're under the skin. It's
I get it. I mean, this actually looks remarkably good. But again, I worry. You know, when you're 75 years old, where are these things going to be?
Exactly where we put them.
I hope you're right. Okay, put your shirt back on. Let's
okay.
Give you a chance there to get it back together again. Michelle Golland, you're out there listening to our conversation with Justin. Do you have concerns about what's going on with him? We're helping him put his clothes back on here. Well, I'm just for the record. I worry. I mean, Justin seems very cool with all of that, everything he's done. He's very committed to. And by the way, what is this like a career objective? Is there something you're going to do with all this? You're going to be a model or a
referral and consultation service,
and
where I can help other people to be able to modify themselves the same as I have.
Sit down. This I got to hear more about.
Yeah.
You want to be
I am
a consultant for other people using plastic surgeries.
I've done it for years for free with my friends, and now I'm just going to be able to offer it to the public.
Are you a gay man?
I am.
I don't mean to. I mean, if you don't want to talk about it, I understand that. But my question is, do the guys like this? Is it something that you find you're,
I think that's more based on my personality.
Or do you have a boyfriend? Are you monogamous? I mean, is it something?
I have a partner.
You have a partner, and he likes this? He thinks this is great?
He's completely supportive of it.
Does he do a lot of this stuff too?
No, not a lot, but he's not opposed to it. If one day he feels like he needs to, he would.
Okay, Michelle, let's go back out to you. So Michelle, are you concerned? Now, here's obviously the easy concern is that there's a body dysmorphia problem underlying this, and the surgeons are reinforcing that rather than asking him to get some help for that.
Absolutely. I mean, I think there is that concern, and I have to say, I saw you in the green room, and I could really feel for you. I mean, I know you were concerned about which side you were going to sit on, and how that was going to appear. And so I don't even know if it's just about the body dysmorphic disorder, but I think it's about a real preoccupation for what I would call approval.
Okay, how old are you?
I'm 32.
32. Is this, Michelle, a bigger problem with our young folks in this society, that the only way they can derive meaning is if they look perfect?
Well, I think there's some generational things going on, Dr. Drew, but my concern, honestly, is really just how it is for him. How much of a barrier is this emotionally for you?
I don't think that it has to do anything with, I'm sorry to cut you off, I don't think that it has to do anything with looking perfect. This isn't I'm not looking for an end result. There's not an end goal.
Well, you can just keep going forever. You've had 90 surgeries already. How many more are you going to have?
For me, it's my art form.
Your art form?
It is. It's a way for me to be creative and to work in tandem with the doctor to try to create something. I mean, my journey with modification has progressed where it's no longer a need. So this is just purely.
Do you get high off the painkillers that they give you?
No.
That's why a lot
actually,
of people
Dr. Drew,
Michelle, go ahead.
I want to say that I don't think it is about getting high off the painkillers. I think it's about getting sort of this. It reminds me a lot of the individuals who have an addiction to extreme sports. You know, it no longer is enough for them to just go down the black diamond.
But we live in an addictive society. I mean, how many people could turn off their cell phones for an hour and not be craving to go back and see what their text messages were?
I know, but that doesn't mean that it's a healthy lifestyle.
Let's take a call,
doesn't mean
Michelle.
that it allows
Hold on a second.
to relate.
Nancy, Massachusetts. Nancy, go ahead.
Hi, Dr. Drew. How are you?
I'm good. Thank you for calling.
Good. I'm concerned about his mental state.
Well, that's what we're trying to get into a little bit here with Michelle. Is that he seems great, right? I mean, on the surface, you certainly you don't have depression.
I think my expectations are very realistic. Yeah.
Your addictions are very realistic. That's
no.
I want to get into because a true addiction has to have consequences. And see, I want to talk to your doctors more than you, because there's people out there willingly enabling. Let's say just for the sake of argument.
Like that at all.
I get you don't. Well, tell me why. Tell me why not.
Because I look at my body as sculpture. So
why not work out? Why not do healthy things? Why going to the knife? I mean, 90 times under the knife. That's a big deal.
I'm not necessarily trying to look like everybody else. I have things over time that have sort of affected me, and with my travels and the people I've met.
What do you mean by that? Things that
with my travels and having become more worldly and more experienced, and I've taken more things in than when I was 17. What I initially thought I wanted to look like has changed since that point.
Well, there you are. Look at you back in high school. You look like nice.
I was still a cute kid.
Cynthia in Nevada. You were a cute kid. Cynthia in Nevada.
Hi, Dr. Drew.
Hi, Cynthia.
My question was, how much can his body take, and then when did he get off track where he was so dissatisfied with what he looked like? Because his high school picture, he's very handsome, and for somewhere down the line, he's got off track and altered his body to the way it looks now.
Right. That's it's sort of the how much is enough question. And let me ask you this. What if somebody were to say to you, I liked you better in your high school picture? How would you respond?
It's okay, because I didn't do it for other people. If anything, I know that even future surgeries that I have, more people might actually be against those things because they think it might not make a positive result.
All right, that's what I want to get into. Yeah. Well, I'm putting my hands on one of your surgeons, and that's exactly what I'm going to do next. When will he say no more surgery? Does he have there are no limits? Michelle, you're shaking your head vigorously. What about the surgeons? Do they at no point say that's enough, Justin? We'll just keep doing this until and the revisions, and it makes me scared.
It has to do with your motivations, Joe.
Well, let's talk about my motivations when we get back. All right, I'm back with Justin Jedlicka. He has had 90 cosmetic procedures and has no plan to stop. He says to try to get him to stop is like trying to get Picasso to stop painting.
It's true.
And then you made me sort of, after asking me if I was trying to pick up on you, you asked me, or I asked myself what my motivation is in sort of examining this, because I'm interested in people, I'm interested in their behaviors, I'm interested in extreme behaviors, and you're extreme, right? And it makes us work. You're extreme. And it makes us worry that there's something motivating that. And particularly, I got to tell you, well, first of all, I think it'd be great to have a plastic surgery. That'd be fantastic. Why not have a little bit here and there, right? Sure. To me, that sounds like wonderful. I won't look so old. It'd be great. But here's the deal. Here's why that's not going to happen to me. It's a surgery. And I understand what that means, to have a surgery and to go under the knife and to take those risks for a cosmetic purpose that's sort of, for me, I'm going to use a stronger word, like superficial, okay? That I don't really want to put that. Now, how would you respond to that?
I think that you have to take risks. Anything in your life worth having is going to require some form of a risk. And if you don't take those risks,
if I develop a staph infection, I'm going to talk to your surgeon in a second, because he's here with me. If I got a staph infection because I had somebody sucking fat out of my butt, what do I tell my kids? You know what I mean? I can't make livelihood anymore. I mean,
you're honest with them, but yeah.
Well, no. Let me go to the surgeon. Let me talk to. Could you guys please put? There we go. If you guys would please. There we go. Dr. Nicholas Shugay. He is one of Justin's several cosmetic surgery. Now, I want to ask you, sir. You have performed which procedures on Justin?
Well, I've performed the biceps, triceps augmentation, and also we've done some fillers, Botox.
He did the Botox. Okay, I thought I said buttocks, because that was somebody else, right?
No, that was
okay.
Right.
Now, were you aware he'd had dozens and dozens of procedures? And when he came to you, did you have that history? And if so, were you concerned about doing more?
I was aware that he had quite a few procedures. But at the same token, they were done a long time ago. They were a period of time before. And we have discussed complications and everything that has to do with each procedure. And he did very well with them.
No, I see that. Okay, so I'm an internist, Dr. Shige, and I, you know, deal with people in their 60s, 70s, and 80s all the time. That's one of my sort of jobs in addition to addiction medicine, and people sort of forget that about what I do. But I see what happens way down the line with tattoos and piercings and all these things that now people think are so cool when they're young. Isn't he going to have revisions of all these things? Aren't they going to migrate?
Usually the body will form scar tissue around the implant. And that scar tissue is sort of the pocket in which the implant sits pretty much for the rest of his life.
Well, that's go ahead, Michelle. I was going to go to you next. That's what the patient was telling me, in fact. Go ahead, Michelle.
I have to say, Dr. Drew, I feel like focusing on this physical aspect is really losing the critical point of what I believe is happening here. Okay? What is happening here, to me, are these parts that you know, I don't know if you've read Histrionic Personality Disorder lately, Dr. Drew, and narcissistic, but like this is those qualities. And the concern is that as soon as these doctors, to me, what needs to happen is that plastic surgeons have to have some protocol towards checking out the mental health of their patients. And I think anyone who is watching this show would be highly concerned about another doctor performing more surgeries, and not just I'm not saying that you don't look attractive or these things aren't, you know, at some point though, there is a serious mental illness that could be happening here, okay?
Quickly, before you respond, Justin, I feel you bristling to that. Let me go to a call. Sue in Florida. Sue.
Yes, good evening. How are you?
Good. Right ahead.
I have two questions. I was wondering, one, how is Justin funding all of these
Great
multiple
question.
surgeries?
Yes, it's because you must be. Hold on a second, so I want you to stay with me. You must be $1 million man. I mean,
No, not nearly.
not nearly, or nearly.
No, not on my surgery.
How do you fund it?
You know, I was brought up in a lower-income family, and I was taught the value of $1, and I've always just saved for my surgeries, and it was something that was important to me. And
Do you take loans out for them?
No, never.
You never take a loan?
Nope, and I have no debt.
What do you do for a living?
Well, at the moment, I'm doing my consultation bit, and I have a partner who I'm lucky enough who has a business that can support us.
So he helps. He helps funding too.
He does if I ask.
Okay,
sure, but
fine.
I also use my own savings. As well.
Fine. Sue, second question.
Yes, and I just wondered, has Justin had any surgeons refuse to provide any of the surgeries
Good
that
question.
he's requested previously?
How about that?
Never based on motivations. No.
What does that mean?
I've had doctors
based on motivation.
that didn't want to take on the
risk.
The possibility of making my nose worse because I had already had revisions before. But it wasn't based on my expectations being unreasonable.
Well, hold on a second. So you were turned away by surgeons because you were pressuring for a repeat and a revision, and then you shopped a doctor until you found one that would do it?
No, I went to more skilled doctors.
More skilled doctors.
I went to people who specialize in rhino revision, and not all people.
Well, let me talk to Dr. Shige. Hang on a second, Michelle. Dr. Shige, is that okay? Is it should patients be driving these things to that extent?
Well, again, we talked with Justin before about his nose. I told him, Justin, don't let anybody touch your nose again.
Well,
5 surgeries is plenty.
Okay, right. Yes, it is. But somebody told him that at 4. Somebody told him that at 4 surgery, and he still went and found somebody else to do another. And that's sort of what we're trying to explore here. You know,
small tweaks. These last 3.
Are you wanting another one?
Tiny tweaks. No, in all honesty, this one has to settle. And the last time I had this done was May, and so it's still too soon.
Poor nose.
I got to live myself 2 years, and then we weigh in. But it looks great.
Michelle, finish up there. Go.
And I understand that you bristled when I said what I did. I feel for you.
But you live in LA. This is the most highly concentrated area of plastic surgeons.
I know, but that's not the point. See, I have to say, where you keep going is you rationalize, you deflect, you don't look at the reality of what is being said to you. Those are all, I'm concerned for you.
Okay,
honestly,
guys,
that's
Michelle,
why I'm saying this.
Point taken. Justin, back with you, back with your doctor. More of your calls for Justin, 855-373-7395. Do give us a call. We'll be right back. I am back with Justin Jedlicka, and he and I were just having a really interesting conversation during the break. Now, Michelle, I know you're concerned about the personality disorders and this kind of stuff, but being close to this man, you don't get the usual feeling that I get from people who are addicted to, you know, have body dysmorphia, or who are addicted to plastic surgery, or a very common thing I see are going to plastic surgeons because they want to get the opiates, and they just go from procedure to procedure.
Well, I don't know. I mean, I think he's
Michelle,
charmed you a little.
Well, no, but
much,
maybe that I'm easy. I'm easy. That you're absolutely right about that. Particularly when he said I was trying to pick up on him. I mean, really, we've been in love ever since.
I've been watching the whole thing.
Well, hold on.
I think he's charmed you a little too much.
It might be, but hold on a second. Michelle, point taken. But he educated me about something I thought was really interesting and did kind of fit for me. That is that he lumps himself in with the sort of piercing and tattooing and body mod. Body mod. And I said to him during the break, I said, well, you know, a lot of body mod people have a history of, they don't like to admit this, but they have a history of physical abuse and domestic violence stuff in their household. And you said,
I did come from a household where there was some domestic violence.
Right, and so that it kind of explains the body mod aspect of this, which is really not sort of the road we were going down, Michelle.
Well, I have to say, well, Dr. Drew, I mean, if we're talking about trauma, how these sorts of clusters of experiences at their core are developed through trauma, okay?
No, right, no, I absolutely agree.
I mean, I think I have to say, I feel like using this time right now in a way to sort of, it feels to me, lighten the mood, I have to say it's disconcerting to me.
Okay, so your thing would be, your position would be, there's trauma, there's characterological sort of issues with that trauma, and that should be dealt with. So do we do this for every person that has lots of tattoos and lots of piercings? That they...
I think 90 surgeries and surgeons do. I think even you, Dr. Drew, could tell the difference of tattoos and this.
But yes.
Okay, so let me talk to Susan in Pennsylvania. Susan, go right ahead.
Hi, Dr. Phil. My name's Susan.
It's Drew, but that's all right. I got you, Susan. What's going on?
Sorry.
It's all right. I mean, it's a good company. It's all right.
I'm a TMJ implant survivor, specifically silastic silicone, and it caused a foreign body giant cell reaction, which
okay. So let me, and Dr. Shigay, I'm going to go with you on this. She had some sort of silicone. I guess her jaw just deteriorated, and she had some sort of a replacement, and then developed, I guess, some sort of granulomatous reaction, which is sort of a foreign body reaction to that. Can you help explain that a little bit?
Well, with silicone, you can get a granuloma, and you can get infections even, 2, 3, 4 years later, you can get an infection. So that needs to be removed. The silicone that's there needs to be removed, and then the patient needs to be treated with antibiotics. I'm
going to interrupt you real quick and say, don't you then have concerns about these direct soft tissue injections that he's had with silicone? That was my reaction. Of all the things he's talked about, medically, that was the thing that sort of surprised me the most.
Well, medical-grade silicone is one of the most inert substances known to man.
Thank you.
If it is injected very carefully, judiciously, and using, like I said, high-quality medical-grade silicone, like Silicone 1000, in very small micro-drop applications, you're okay. But there's always a chance of infection with any implant, any implant material.
Were you aware of his history of domestic violence and the kinds of things that we're, Michelle and I have been going back and forth about?
No, I was not.
Okay. Carol in Maryland. Carol. Carol? I can't hear her if anybody else can. No. Justin, I want to give you the last few minutes here, give you the stage. We've been sort of talking about you like you are a Ken doll, like you're not here. and Michelle has valid concerns, and she has concerns with me letting you off the hook at all.
I hear her concerns. I mean, I can't live in the past. I have to move forward, and I made my peace with things. I really feel like plastic surgery made an amazing difference in my life.
How?
It enabled me to move forward, to move into a better space. It's opened me up to a different group of people and a new level of confidence that I think I would not have been privy to had I not had my surgeries.
You have a stable relationship.
Correct.
Is it close and intimate?
Yes.
So you're able to have relationships. That's the big problem in trauma patients. They have trouble being monogamous. They have trouble staying in relationships. They sabotage. They freak out.
Sure.
None of that?
No, 3 years and going.
Okay. And then again, you've got about 30 seconds. What else would you like people to know about you as we sort of head out here?
I just look at myself as an artist, and I want to be able to help other people to achieve their aesthetic goals, whether that's beautification and rejuvenation or that's modification, to whatever extent they'd like to go. I mean, it's really hard to find quality doctors.
How'd you not get into piercing and tattoos?
I have always been enamored with the human form, and so anime, hentai, all of those things.
Oh my God, you're gonna be a human anime character?
Oh,
again?
I love
Another
it.
one?
Ah, that's hot.
Okay. All right, listen. Thank you, Dr. Jedlicka. Thank you. Thank you, Justin Jedlicka. Thank you, Dr.
Okay,
Shugay.
Drew,
Thank you, Michelle Golland. I'll be right back in just a second.